I started out as a medical secretary. I was the 13th employee hired. So there was less than 15 people when Northwest Buffalo Community Health Center then began. There was I was the 13th employee. Well, when we opened, there was about 4 patients a day we were seeing in the beginning.
So we're the first faces to the company. You come in and you're greeted by us, and you come in, say you're an hour early for your appointment. We want to get you seen. We want to give you the satisfaction that we can see you early, but we also need to make sure that we're keeping up in our flow of the day, making sure that all your information is prepped and correct, so that if medical records needs to send a referral to your doctor, we have that information. If clinical needs to decide if they need to do a procedure, does your insurance accept that? If the insurance is incorrect, that stops up the day. So PSRs have a lot to do with the flow of the day and a lot of the intricate details that you wouldn't normally suspect that we would have some magic worked in it. And then even just the close of the day too, because they finish up with us as well. So you want to check out, you want to make sure they have every appointment possible, because everybody knows, it's no fun calling into a call center where you can't get through to somebody. So if you get everything done there and then, scripts or referrals, any messages sent because you forgot to bring it up to your doctor, all of that ends with us as well. And then a greeting to end the day.
So I myself have been here for a little over 7 years. I came in to the facility as a PSR, which is a patient service representative. From there, I quickly moved up to the registration trainer. So I trained a lot of people that came in new for the front desk and getting to know our programs and our systems and getting them comfortable to start taking patients on their own. I did that for a good chunk of time, and then I moved over to the CHW office over 3 years ago. Coming in as just a regular CHW, learning the basics, and then progressively moved up to the lead, the senior lead, and now I am a supervisor here at the Blaisdell CHW department. Teamwork is super important in this department. Every CHW has their own provider list that they work on specifically one-on-one with those providers, but we also do have the need for teamwork when CHWs are out or providers are out or the load just gets backed up a little bit. So teamwork really comes into play here when someone is able to jump in someone else's load and kind of help loosen it a little bit, or just lend a helping hand if they're done with their work a little bit earlier. It also comes really into play when we're in that office type field. So if we don't know something, we're able to ask a question, and everyone kind of plays off the information that they've gathered by calling these different offices and learning what insurances they don't take, what patients they're able to see, how long it is into their scheduling. So we cycle that information out together as a unit, so we're all on the same page when it comes to getting the patient the best quality of care they need.
So what brought me here to neighborhood was the cause, what we do, what I see them doing for the community. I've been a patient with neighborhood for a very long time. I have been a witness to the changes that's happening, what they're doing for our community, and I wanted to be part of that. I've always said one day I'm going to work for this company. And when I got the opportunity to work, I took it and I came in, and I've grown within the company. I'm part of a change. I'm continuing to see some amazing things that are happening and will happen for our community, and that is the biggest reason why I continue and will stay here at neighborhood. The one thing that I've always noticed here, and I completely applaud them, is because they are about growth within the community, within the organization. They see the potential in people, they help them grow, and if you want to do something better, you want to grow and be in a different position, they will help you, they will get you there. And that's what I've got from my supervisors and other supervisors here. They don't hold you back, and they don't want to keep you where you're at. If they see your potential, they're going to push it. They want the best for not just the staff, but also our patients, and that's important here.